Welcome to the Los Angeles County Department of Mental Health's monthly magazine, Meeting of the Minds. I'm Karen Zarcedias. In this month's Mental Health Minute, the Los Angeles County Department of Mental Health, otherwise known as DMH, is gearing up for a new cost-saving paperless technology that will help improve the quality of care for LA County residents. It's called the Integrated Behavioral Health Information System, or IBIS for short. IBIS will provide a state-of-the-art electronic health record system. The paperless system allows clinicians more time to see their clients and less time is spent with paperwork. IBIS will speed up the billing process for the county and will improve communication between county departments like the courts, probation, and sheriff. DMH is planning to get this electronic health record software up and running by next year, well ahead of federal and state deadlines set for 2015. In other news, a study by the UCLA Center for Health Policy Research has found that 1 in 12 adults in California has mental health symptoms or illnesses that require treatment. But the report found only half of them is actually receiving the care they need. In the study, researchers recommended medical doctors screen their patients more thoroughly for mental health problems beyond the physical health screenings. Researchers also suggested that physicians refer patients to specialized providers so they can get the more specific help and treatment they need. Hope, Wellness, and Recovery is our department's motto. With more about what DMH is up to, here's a message from our director, Dr. Marvin Southard.
Thank you, Karen. At this very moment, the public mental health system in Los Angeles County is taking the first steps in a journey that will change for the better what our clients and our workers experience as they pursue together the department's vision of hope, wellness, and recovery. Our destination on this journey is the implementation of a world-class information system that has been designed from the outset to support clinical practice and decision-making in an elegant and practical way. We call this system IBIS, or the Integrated Behavioral Health Information System. We prepared for our journey by a careful planning process that included our clinical workforce and their unions, our administrators, our clients, and their families, as well as technical experts to figure out what features our new system should have that would alert us to clinical risks, facilitate joint planning with our clients, improve the billing process, and make the collection of meaningful outcome data easier. But planning is one thing and implementation quite another. Now that we have the basic plans in place, we must begin the process of building skills and changing our clinical and administrative practices. We know that no matter how great a tool is, it does no good unless we use it. And we cannot use a tool to its full potential unless we begin to reimagine all of our activities in the light of that new potential. We expect that there may be a few bumps in the road, but within a couple of years, we expect IBIS to be a tool that allows us to bring together all of the personal health and behavioral health information that a treatment team needs to provide the care that is necessary to make hope, wellness, and recovery a reality, and not just a slogan.
Thank you, Dr. Southard. We like to share stories and tips on wellness and recovery on this show. With more about this in our Walk the Talk segment, here's Kathleen Fichet.
Thanks, Karen. My guest today is Karis Myrick. Karis Myrick is the president and CEO of Project Return Peer Support Network in Los Angeles. She holds an MBA from Case Western Reserve and has an MS from California School of Psychology. Karis was featured on the front page of the New York Times as part of a series of articles entitled Lives Restored, Living with Mental Illness. She believes that each person should have as much information as possible in order to make decisions that will help them realize their dreams. She should know she's on her own journey of wellness and recovery. Welcome, Karis, to Walk the Talk.
Thank you.
Throughout your own journey of recovery, you've been given many different diagnoses. How does that support your idea of how the medical model treats people with behavioral issues?
Well, I think, first of all, you go through a lot of different symptoms and people are trying to figure out what's going on. And I think it reduces a person to just being a cluster of symptoms.
Right, and we don't want to label them.
Right.
Because often those are not correct or have changed.
Well, I think they change over time, or sometimes, like for me, I wasn't disclosing everything that was going on. So it was easy for me to talk about feeling sad or feelings of sadness. It was a little bit harder for me to talk about hearing voices, seeing things, because I knew that was, as I had seen on TV or movies, that was what we called crazy, and I didn't want to be known as crazy. It's okay to be known as depressed because it's an everyday word. At least that's how I understood it.
So how did you finally get help?
Well, initially, my mom had a concern about some things that were going on when I was a bit younger. So I think she, saw the sadness and, wanted me to go in for some assistance. And then I had stopped eating for a while because voices were telling me that food was poison. I did not tell anybody that, so initially they thought I had an eating disorder because I had stopped eating and lost a great deal of weight. So I was already used to going in and speaking to a therapist and talking to folks about, issues that were coming up, but I just wasn't disclosing 100%.
Everything.
Correct.
Yeah. And how did that come out eventually?
Well, I was in a grocery store doing some shopping for some cereal, and I was being told, oh, that's poison, and this is poison, and so I would go to pick up a cereal box, and I would hear, oh, it's poison, so I'd reach for, 2 cereal boxes back, thinking, oh, yeah, you're supposed to not pick the first thing off the shelf, pick the third thing, so I'd pick the third one, no, that was poison, then I'd pick a different brand, and then I heard, clean up on aisle 7, and when I turned around, like the whole aisle was totally decimated. I was not taking the cereal and putting them back. I was actually just throwing them and just destroying the whole aisle in the grocery store. So that's when, we knew something was really wrong.
And then you started talking about what was really going on.
Yes.
Mm-hmm. And how do you maintain your recovery now?
Well, I think I was doing it all along, and maybe I didn't know that it was part of a coping mechanism, which is to keep incredibly busy. So I was going to school, going on after I got my bachelor's degree to getting a master's degree, and then kind of kept on going. And when things would go a little bit rougher, if symptoms were really kind of getting in the way of doing the things that I liked, like going to school or being in extracurricular activities, then I would, talk to my psychiatrist or my therapist, my friends. I have a psychiatric service dog named Steinbeck. He's retired out now because he's an old guy. He doesn't know it, but he's an older dog. So he's very helpful. Talking to my family is incredibly helpful.
So you have a support network. You have your family, you have friends, you have your dog. You have things that kind of give you feedback about what's going on.
Sure.
That's great. What advice would you give someone who may be having problems and may need to see somebody?
Well, I think reaching out to someone and being able to find someone to talk to, that one person that you really, really trust, who you'll know will never leave you. And, for many people that can be a family member. For some people it can be what we call a family of their choosing, a best friend or a teacher. But to be able to find that one person that you can share what's going on in your life, so that you can, again, seek the help that will help you get through. And it's all sorts of things, from peer support to could be medical treatment, a psychiatrist, psychologist, peer supporter.
Anything that helps, basically.
Anything that helps, clergy, anything, yeah.
Thank you so much for coming in today. You're definitely walking your talk, and I can't wait to see what you do next.
Okay, thank you.
You're worldwide.
Thank you.
Back to Karen.
Thank you, Kathleen. And that's the show for this month's edition of Meeting of the Minds. To learn more about the Department of Mental Health and for more information about DMH's programs and resources, you can always visit the website anytime at dmh.lacounty.gov. You can also follow us on our Facebook page and watch our Profiles of Hope videos and PSAs on YouTube. Just search for the Los Angeles County Department of Mental Health, or LACDMH. And if you or someone you know is in need of help, you can call our 24/7 access line at 1-800-854-7771. That's 1-800-854-7771. Thank you for watching. We'll see you again soon.